So I'm Stephanie Sinn. I'm CPA and an accountant at Advanced Medical Transport, ambulance provider in Peoria. And we're going to start the day off talking, like Bill said, about taking your benefits administration to a digital platform and if it's even worth the effort to do so. So full disclosure, like I said, I'm an accountant, not in HR, talking to you about benefits administration. So a little bit unique perspective into that process. I've worked with payroll and payroll systems for about 7 years, most recently in industry accounting the last 4 years, where I again inherited the payroll system, the payroll processes, and then working with HR where those two worlds bled together. That included updating, implementing, managing the HR system, and going through twice now, implementing benefits administration through 2 different systems. And we took that to the full realization of taking the information in our HR or HCM system in a carrier connection feed directly over to our benefits providers. So I'll try to say the words ACA only a few times today, and hopefully not in a bad light, since it was the driving factor for a lot of small and mid-sized companies to even begin considering digitizing this benefits administration process. All of the tracking, reporting, required notifications, and compliance might have been just too much for the manual process. For our company personally, that's what it was. The risk of misreporting, the risk of non-compliance was too much for the manual process that we had in place. So I'm an accountant. Whenever you make a business decision, we like to do a cost-benefit analysis of the time it takes, the cost to your company, the quality of the outcome that you're going to receive. So we'll use that today as a guideline to kind of look through if this is the process that your company wants to go to, and sprinkled into that will be some questions to ask your own company internally, externally to your service providers, some questions that we asked along the way, some questions that I wish we would have asked along the way, as well as some best practices that we learned. So before you can know the right solution and if it's worth the effort, you need to know what your current situation is. If this is what HR feels like internally, what their office looks like when you walk by during open enrollment or maybe on a daily basis, you're already asking the question, how do you get rid of the paper involved with benefits administration? More than just HR departments are asking this question, and going digital or paperless is not going to be a one-size-fits-all solution when you're talking about benefits administration. So on the screen, there are several different options for how you could start digitizing your benefits administration process. These are not going to be all-encompassing, and a lot of businesses are going to take different pieces from this to find the right solution for them. There's varying price points on these, varying time commitments to the solution that'll be right for you. I'm going to focus primarily today on the solution that you can find within your HR system, referred to as HCM or an HRIS system that most likely already has payroll in it, and the add-on feature of benefits administration. The benefits and costs will be similar within the HCM environment as any of the other options displayed here. So each company will have its own unique constraints, requirements, goals that they're trying to achieve with the process change. The first question you're probably going to ask is, what is the budget that you're willing to spend? For benefits administration, this is going to either open up a lot of opportunity for solution, or it's going to constrain you to just a few vendors, to just a few options. And then when you're talking digital and the benefits to be reaped from it, are they going to be the same across your whole workforce, across your whole workplace environment? If you are spread out across multiple locations, allowing HR from a central location to manage all of those employees might be easier by going digital. If you have a young workforce, they're probably going to love any solution you can put in the palm of their hand with the device that's already there. If you have an aging workforce, how reluctant to change have they been in the past, especially when you're taking their paper processes to a digital platform? And then also the demographics of the workforce. We ran into, is your employees even going to take advantage of the self-service options that you're providing them? Do they have access to the technology to do so? Or are they going to be coming back to HR, back to their supervisor, and asking you to do the self-service piece for them? And then finally, the complexity of the benefits package that you offer. Is it just health insurance that you're talking about digitizing, or are you going to be using expense reimbursements, uniform tracking, retirement plans on top of your health insurance enrollments? How many carriers are involved in this process? Do different departments, divisions, and locations get offered different benefit packages? Can the HCM system that you have handle this, or do you need to maybe look at a standalone process? Do you need a direct feed of all of your enrollment information from the HR system over to your benefits provider? What does payroll require in order to get those employee paycheck deductions set up? And then are you going to involve a retirement plan in this process? Because that's a whole other department you need to worry about. So the answer to these questions will help you determine how dynamic of a solution you're looking for. And then again, within that HR system and HCM process, we found that a lot of small to mid-sized companies can benefit from this, allowing them to keep a personal hand on their employees' benefits enrollment, while a cost-effective way to enjoy some digitizing automation to their benefits process. So again, I'm an accountant. When you tell us about a process change, we automatically go to what is this going to cost us. As an employer, you know that you have a cost behind all of the different benefits that you're already offering your employees shown on the screen. Now we're going to talk about the cost of a system to manage those beginning costs. And paperless or digital is the current trend that we work in, but it's not a cheap solution, and we already know it's not one size fits all. So whenever you talk about changing a process, especially going digital, you're going to have an implementation period. This is where all of the time and money effort is going to start. So we'll start talking about the cost to your bank account. This is going to vary per vendor that you shop around and see. And you should shop around and see because each vendor has a different solution. Each vendor has a different price point. You're going to want to use those to compare to find the right vendor for you. And then there's going to be upfront implementation fees that might be due right at the beginning, at the end, or spread across the process, as well as your regular billing cycle for the HCM system or the benefits add-on. Are they doing that monthly? Are they doing that per head, per check issued? All these things to try to figure out your cash flow process at the end of it. And then there's more than just dollar cost to consider. Implementation takes a lot of time and effort. A successful implementation takes a whole bunch of time and effort. And if it's not done right at the beginning, you're going to start probably vendor shopping around because your implementation failed. Vendor B offers you a better option than vendor A does, and you go through the process of implementation again, switching vendors without learning the right questions to ask or the time that you need to commit to the process. So, what's some of that time and effort that you need to put forward, those necessary steps to a successful implementation to get the benefits of your process change? And it's all going to start with the data. So as an employer, you might think that you provide the data to your third-party vendor and they're going to do the magic, make it happen behind the scenes, set up everything for you, you're good to go, you're told when you can roll it out to your employees, which is only partially the case. They do a lot of things behind the scenes to take their system and set it up for you based on the data that you provide. So good data in will be good data out. You need to make sure that you verify the data that you've provided to them at the beginning and then keep track of any changes that you've had. You've probably hired employees, terminated employees. There's going to be benefits implications with those. And then before you go live, as your implementation manager might refer to it within the system, take the time to re-verify that data so that their first step after implementation isn't chasing down all these errors that you didn't take the time to verify. And then also, you need to know how to set up the system, how to manage the system. So ask your vendor some questions when it comes to training and using the system, such as what or how is benefits training done? How do you set up benefit plans within the system? How does benefits talk or connect to payroll within that system? How does open enrollment work within the system? Do they provide you specific training on open enrollment? And then if your system is really advanced and it offers you ways to communicate and notify your employees, how do you use those to use the system that has all of your HR information in it already to communicate to your employees? And this is about your employees, so they need to be aware of it. You should also ask your vendor, do they come on site to provide training to your employees? Do they have online options for your employees to learn about the system, or are you, the employer, solely responsible for making your employees aware of the change in systems and training them on how to use it? They're going to become your point of access into the system, so their knowledge and engagement is going to be another key to your success. And then there could be a secondary implementation if you decide that your solution also involves carrier connections, which are really fun and really cool. Taking that information, all of your enrollment data from your HR system and directly feeding it over to your benefits carrier or your TPA. This comes with more upfront costs. It does come with a monthly maintenance cost as well for those feeds that you have set up. So the more carriers involved, the more costs that you might have. And this will be one chance though where you do get to sit back, let the people who know more than you do set up those feeds and connections, and then you still need to take the time to verify the data. Not verifying the data can mean that your bills aren't right, that you're chasing down errors from the beginning, or you might have accidentally dropped an employee during the implementation process from the plan, and that's not a phone call you want on a Friday afternoon. So what questions can you ask of your TPA, your benefits carrier, and your vendor to make sure that you understand your carrier connection implementation? How often is the feed data sent over to the carrier from your HR? Within your HR system, what data is included in that feed? How do you input or manage that data? How does the open enrollment period differ from a normal weekly or monthly data feed? How do new enrollees, re-enrollees, plan terminations get captured and terminated on a regular reoccurring basis, and especially during open enrollment? And then if you do find any reconciling items, who do you need to go to with those questions? So that was a lot of time and effort and cost involved in implementing, but there's a lot of tangible benefits to you as an employer that you can receive, and the benefits of just investing in your employees, the dividends that that'll bring back to you. So I'll paint a picture of what a open enrollment process could potentially look like, or a process that you came from. It's open enrollment season, the new benefit plans have been finalized, and employees need to be communicated their options and get all of their enrollment packets. You determine eligibility according to whatever the government said is the new law. Employees' email addresses and mailing addresses are obtained from one system. And then the proper notifications and benefit packages are sent out to the employees either via email or via the mail. And then HR, on top of their regular daily tasks, get to begin starting to follow up, making sure the employees receive the packages, making sure that they're turning back in, making sure the paperwork is filled out in its entirety, of all the information that they need to enroll employees, to put new employees into the plan, and their dependent information. Don't forget about letting HR or payroll know about the deductions that they need to take from the employees' paychecks. And then on the last day of open enrollment, an employee walks into your office freaking out because they didn't get the package and they're not going to have benefits. So you stop what you're doing, you go through the paperwork with them, and at the end of the night, when everyone goes home, you do the data entry required in this process. 5 days after open enrollment occurred, some of those employees who were ignoring your phone calls come into your office, and they're freaking out because on January 1st, they're also not going to have benefits. So you stop what you're doing, you pull out the paperwork, you walk them through the process, and then when everyone goes home at night, you do the data entry involved with this again. It's the same thing when you have a new employee, it's the same thing when you have a qualifying event. Imagine what happens when you have an error or an issue within this process that you now have to take the time to resolve. So in that scenario, HR's priority was enrollment within the plan. It wasn't making sure the employees knew what their benefit options were, what the PPO or high deductible plan could benefit them the most, where they could use their benefits, what the max out of pocket was, what the deductible options were for the different plans. It was in the packet. Didn't they get it? I put it in bold and italicized in the emails. Didn't they see it? You weren't allowing your employees to see the full benefits that you were offering to them, for them to know the full value of that package. Reducing the manual processes allows you maybe more time to do on-site training with your employees. Maybe your TPA comes out to provide some of the benefits information. You have the time to make sure that the benefits piece of employee benefits package is known to the employees. And you can also use that HCM HR system for transparency on the employer contribution that you're giving to them. In a real-time environment, an employee can log into that system, see what the employer is contributing to their HR or to their health insurance plan, see what the employer is contributing to their 401k plan. It's not a number or percentage that you talk about in orientation and annually at corporate compliance. It's a real, tangible, cumulative benefit an employee can access at any time. And then there's that convenience of living in the digital age. Most of your workforce is probably doing their personal tasks on a mobile phone or tablet or their personal computer anyways. It's allowing them the convenience of taking care of their enrollment into benefits on that device as well. You can put all the necessary information that was in that paper packet, plus some videos, some links to other websites, Where can they use their provider information? It'll be within that employee self-service option within the HR HCM system that you're using. They can involve others in the decision. You're empowering them and putting the tools in their hands to take control of their benefits. And they also know their personal information better than you. So you're not copying the information from a piece of paper and putting it into the system. The employees are in charge of putting their own personal information into the system. So the employee benefits piece will pay you dividends as an employer when it comes to employee engagement, but there are some real tangible benefits to employers as well, starting with just time savings to HR of reducing some of those manual processes. You're paying them to engage with your employees, not to do data input and chase down errors and do corrections. So if you have a small HR department, a lot of their overtime costs can come from doing manual data entry, manual processes, a lot of the behind the scenes after hours stuff that they have to do when they're not dealing with employees on a day-to-day basis. So you can save time and money by reducing some of those manual processes. You can also have some savings through the reduction of errors. In the ACA world, an error in your employment or in your enrollment information could mean a fine. To an employee, it could mean that they or their dependents aren't enrolled in their plan of choosing. To an employer, it's the time and effort to track down the cause of that error, correct it, deal with all the parties that are involved in the process, as well as manage your employee and their concerns. In the quality control world, they have something called the 110-100 rule, and it can be applied to data quality as well. It's a lot easier to verify information at the point of entry into the system, 1 unit or $1, than it is to fix an error at the end of the process. It's also a lot easier to find and correct an error during quality control or review, 10 units, $10, than it is to find that error, correct it once the system has released it into the final product. But just because you're reducing manual processes, you still are a little bit at risk for error. There's still a human element involved. Your employee is the one handling, entering their information into the access point within the system. But you've freed up some time in HR's world. They've got a little bit more time to change their process to be focused on approving, reviewing, and spending some time doing quality control. This could involve reconciling your system data to your invoice. And then a standalone system, rather than an HCM system, will provide you a little bit more opportunities when it comes to how your invoicing process would work, further reducing your risk of error and manual processes. Speaking of billing, going the extra step and adding carrier connection into your solution will allow you a little bit more accurate billing. Once you've worked out all the kinks and wrinkles during implementation, ideally there's not going to be a huge time lag between when you have enrollment data entered into your HR system to when it's going to show up on your invoice. So you're not waiting months or weeks for a retroactive change, maybe $40,000 at the end of open enrollment, to show up on your invoice from Blue Cross Blue Shield. The system is going to allow you to report on who you expect to see on the invoice, what your expected cost should be for that month, and then you can compare that to the invoice, more so paying the actual expense, the actual cost of benefits for your employees for that month. And then there's also data integrity involved with it. The more you integrate systems, the more you're maintaining the quality of that data. It's the telephone game that you played. The more people involved in the process, the more diluted and changed that message got by the end user. The same thing is with your data. The more you're entering it into multiple different systems manually, into different tracking tools, the more you're putting that data at risk for not being as accurate. And reporting and data quality. So we're going to talk about data analysis. You can pull the reports from your system to be able to use that data for more data-driven analysis and tools when it comes to making decisions on your employee benefit plan, how to reduce the cost of that. And you've maintained the integrity of your data by using a single system. HR, payroll, employment, employee benefits are all within one system. So you can pull all that information into one report. You're also not having to take HR information and let payroll know what the deductions are going to be. Again, it's all within one single system for you to use. So back to that beginning question, is it worth the effort to go digital? And it honestly is going to take a lot of time and a lot of effort and a lot of upfront costs. You have to find the right solution. You have to know what your requirements for the system are going to be. You have to realize you're going to have to put time and effort into implementation and the time and effort into training yourself, your staff, and your employees. But the benefits are more employee engagement, convenience to yourself and to your employees, reduction of manual processes, more time saving, reduction of errors, a single system entry point, and then more access to data for future decision making. And the benefits can go on and on and on the more that you play around being within an HCM system. The decision is going to be like that beginning decision, finding what works best for your company, but realizing that with the compliance and technology landscape, going digital seems to be the preferred solution for most companies, regardless of your size. It's more about your success is going to be dependent upon your own engagement and investment into the process, realizing that this is about your employees and your company's long-term goals rather than the upfront short-term costs to achieve those goals. So that was a lot of information, and if you're like me, you live off of coffee, and you're thinking about the next cup of coffee you can get before Paul talks about more data analysis. But are there any questions that come to mind on any of that information? If there's not any, a question I get a lot when I'm talking about benefit suites is going back to the implementation process. Everyone's worried about the effort and if it's going to pay off in the long run. And they ask you, well, what was implementation like? And they're really trying to get out of you, what did your implementation manager from the vendor do to make the process really easy? And I kind of like to throw the question back at them because at the end of it, it's your product, it's your process. You need to make sure that you are committing the time to it and that you've got the right people involved in it, because otherwise you're not going to see those benefits of the daunting implementation period of your own system at the end of it. So thank you guys.